So looking at chronic fatigue syndrome, I think all of us know, and it's in the diagnostic criteria, whether you're using the 2003 Canadian Diagnostic Criteria or the ICC criteria, that the neurological symptoms, the autonomic nervous system symptoms, the endocrine symptoms, the immune symptoms, and so on. So I think, this is why I think viewing chronic fatigue syndrome just as a central sensitization without really looking at the brain's that is a remarkable computer that it monitors information going to the brain, but it's also responsible for sending out messages to endocrine organs or blood vessels to shrink so that you can get more blood to your brain. And so the central computer is stuck. It's faulty, but there's a lot of other pathophysiology that's going on, which I think needs to be addressed every time patients are having a treatment protocol put together for them. So you can I'm not going to go through all of this. You can probably read those in all the diagnostic criteria. So this is also very exciting. It's a busy slide, I apologize, but I just thought I'd list some of the fantastic studies that are going on down south relating to Neuro Immunology. And I think this is vital for us, certainly as a society. That would be one of my goals, is to try and build bridges with these groups, and I've already had a wonderful opportunity to meet a lot of them. I've met Maureen Hansen from Cornell, and Maddie Hornig from Columbia, and I've met also Beth Unger from the CDC, and Andy Kogelnick from Open Medicine Institute, and just some fantastic conversations and networking. So hopefully we'll be able to build some bridges. But you'll see immune signatures that Dr. Hornig's looked at and published that very pivotal study about the immune system being abnormal, particularly in the first 3 years of chronic fatigue syndrome patients' condition. Thereafter, the cytokines and all the measurements are a little flat. So something else kicks in, and maybe it's metabolomics, maybe it's metabolites and not the immune system. So when I worked with Dr. Cheney, he was right, I'm afraid. He said you have an infection or some insult that activates this huge immune response, and then your body doesn't know how to adjust to that, and you get into this chronic metabolic issue, which, I think is quite correct, as the research is pointing towards that. So Nancy Klimas in Miami, she's doing fantastic. She's been working, on neuroimmunology for ages. Dr. Hornig, again, looking at cerebrospinal fluid, the most consistent immune finding, because we're dealing with such a large group, all having the same symptoms as a result of a common biological pathway. They're different etiologies. Some of you had an accident, some of you contracted mono in your teens, some of you had salmonella, food poisoning. Some people have had chemotherapy after cancer, and boom, their system shut down, and they have chronic fatigue syndrome. And so there are all these different causes, but we were hoping that by looking at the immune system closer, we'd be able to sort of find different biomarkers for different causes, but it's not that easy. This was looking really in the wrong compartment. And I think, although it's vitally important for future treatments to understand these immune abnormalities, I don't think we're going to be really getting closer to biomarkers very quickly if we only look at the immune system. But they're also looking at, if the Cornell group is doing fantastic stuff with looking at the gut microbiome, and this is what naturopaths have been saying for years. That's your gut flora, it's your dysbiosis, and now the medical world has taken this on in storm, and this is the latest and the best theory of every chronic disease, that but they call it microbiome. It's exactly the same as a dysbiosis. So this has been studied in a great deal, and also causing leaky gut. You might have heard your naturopath say you've got leaky gut. That's also now huge. Leaky gut is now in sort of formal clinical trials, and if you have leaky gut, then all these critters and large proteins leak into your bloodstream and activate your immune system. And so these are things that naturopaths have been saying for years, which is now being thankfully researched properly, and I think that's very exciting. Lastly, looking at mitochondrial issues, I think the mitochondria seems to play a huge role in the sort of later stages of, which makes sense. I mean, there are mitochondrial energy stations in every cell in our body, in the brain, in the endocrine hormones, in the heart, in the skeletal muscles. So there's got to be something defective there. So what about metabolomics? It took me a while to pronounce it, to learn how to pronounce metabolomics, but I think I managed to get it right. I've had some amazing discussions very recently with Metabolom. They're a company in the research triangle in North Carolina, wanting to hold hands with anyone who wants to do a study. And so they're involved in the recent Dr. Naviaux study. They were a company involved in that. They've said, if we can find some money, let's do a study looking at metabolomics from patients in Canada. So, but basically, initially, and you know, Dr. David Patrick's study was looking at DNA sequencing. So for a while, researchers have been focusing on DNA. Is there something mysterious there that's giving us answers about chronic fatigue syndrome versus fibromyalgia versus lupus versus chronic Lyme disease? Then they started looking at proteins, and they're still looking at proteins. But the most exciting thing is much further down the production line, because your DNA transcribes via messenger RNA to make protein. The protein is used in metabolic biochemical reactions, and you get metabolites, and bing. That's the body compartment that is starting to show some absolutely fascinating data. There are now clinical tests that are ready to roll. If you've got a strong family history of diabetes or cardiovascular disease, you can get a metabolomic test to see if you've got insulin resistance as early as possible so you can treat it, or glucose intolerance. So we can order those tests, or we can push the government to include it in the battery of tests that we want to do. Any questions about metabolomics? This was the study, new breakthrough study, which I think is going to be the beginning of many. So 84 patients were examined to determine their biological pathways. 45 were CFS patients diagnosed with the disease, and they did have controls. They had 39 age sex match controls, but no other disease controls, just to put that in there. If you look at the Konosky Performance Scale, that's a scale measuring the severity of fatigue. 54/62 is not great, but I'm thinking to myself, what about those people in 40 Konosky, or 30, those bedbound patients? What do their metabolomics look like? They tested 612 metabolites in plasma, and coming from 63 biochemical pathways. All of us doctors hated biochemistry in medical school. That was a lousy subject. But let me tell you, the chronic fatigue syndrome is applied biochemistry. It's breaking things down to the orthomolecular level. That's where the answer lies, I think. It's not staring us in the face, but patients are having difficulty with their biochemistry. So CFS patients showed within these biochemical pathways, 20 pathways were consistently abnormal, irrespective of what caused your disease, irrespective of the etiology, which is so interesting. So there's that common biological pathway where you're producing metabolites in 20 different pathways that they've discovered so far, and bang, 31% of ME patients have something organic going on with their biochemistry. 80% of those biochemical pathways, 80% of the 20 metabolic pathways examined showed that there were 80% of tested metabolites deficient, consistent with what they call hypometabolic syndrome. Your body's it's just in a survival mode. It hasn't got enough energy to get better. There's no energy. If we could infuse energy in an IV, the body would function. But the big question is, how do we treat? How do we wake up the system that has been damaged and been put into a hypermetabolic state? So some of the sphingolipid, for example, has been affected, which causes insulation around the nerves. And with all the brain mapping that we do, we see a lot of what we call hypercoherence. And patients can actually have mini seizures. They can jerk, and gabapentin works and clonazepam works. And it's because probably sphingolipid production is abnormal, so there's short-circuiting going on in the brain. Phospholipids forming cell membranes. If you don't have healthy cell membranes, your cells don't function properly. Purine, we see a lot of patients, with purine and cholesterol are put in one sort of category. Why do patients gain weight with these conditions? Not just that they are so fatigued they can't exercise. There's something biochemically going on that all the biochemical reactions to give you good cholesterol and take down bad cholesterol are faulty. Purines can go up uric acid and form gout. But the other huge thing they found in this study was the mitochondrial dysfunction. And this blew my mind, diagnostic accuracy. So see, here we have a biomarker which I think is a pretty good biomarker so far, but it's got to be verified, and the study has to be looked at, comparing MS patients, cancer patients who are fatigued, and so on. But for the time being, it looks pretty good. If you've got a test that's 94% accurate, looking at 8 metabolites that can say, yes, you've got ME, that's a pretty good test. That was in males, and 13 women are more complicated. But they needed 13 metabolites for us to make the diagnosis. Okay, but men are just simple-minded. So we've spoken about the heterogeneous etiologies. Everyone had the same metabolites that were abnormal. So my questions are, what about the severe group patients? What does their hypermetabolic syndrome look like? That needs to be researched, in my opinion. And it's as simple as a blood test. Boom. And we send it down to the research triangle. Secondly, what about comparing CFS to MS and fibromyalgia? Everyone says, I don't know if I've got fibromyalgia or ME, the symptoms overlap. Look at the metabolomics. You'll probably find distinct differences. And importantly, is it going to be a more reliable diagnostic test than immunological testing, because it spans from when you first get the disease all the way 10 years plus when you still have the disease. So the immune biomarkers are more accurate in the early stages. Interesting stuff. Any questions? Okay.